Our new topic is the spinal disc herniation. So the hernia, we see hernias a lot in the practice, especially in the lumbar spines. 90% of the hernias we see are in the lumbar spines, which makes sense if we look at the alignment of the spine. So anything which can't be compensated in the upper spines, the lumbar spines compensate. And what we see, what is happening when we have a hernia? So the annulus fibrosus, the outer fibrous ring of the hernia, often tears, which allows the soft central nucleus in the middle to bulge out. We see it here on our skeleton in red. This is demonstrating the hernia, which can cause a nerval root compression or spinal cord issues. Other factors which play a big role is, for example, it's the age. We lose water when we get older, so the ring gets more fibrous and less soft. We now try to show you a tape, an epiflow tape for the lumbar spine, for the hernias in the lumbar spine. You can place that tape on any region of the spines. So you can place it in the cervical neck or in the thoracic spine area. That does really not matter. We just now today show the tape for the lumbar spines. Yeah, I would ask you, Anna, please to free up your lower back a little bit. And what's also important to say, I tell you while I cut the tape. So we cut it like a normal star tape, space tape. We tape it without any pulling, so it's just the pulling or the effect comes through the epiflow, which we tape on top. Important is also that what we often see in the practice, that the patients, 30% of the patients age 60 plus, they have a herniated disc, but they don't have any symptoms. So a herniated disc does not mean that you have to have nerve root compression or even pain. You can pull your pencil a little. Yeah, that's enough, Anna. Thank you. So we tape them on top of each other in a diagonal shape. Without any pulling. Make sure you activate the glue a little bit. And our last tape, which I will cut now, goes along the spine. So it's a vertical tape. And here on the last tape, we create the activation latch in the middle. So remove the middle strap, fold it double, and place it on top. The effect we can see now when I pull, so when I use the activation latch, you can really see how that whole lumbar area is lifting. And that big fascia in the lumbar spines, the fascia thoracolumbalis, really gets lifted. Anna can try herself. Anna is flexible, so for her it's easy. If it's not as easy for the patient at home, I recommend that they get some help. Usual thing, 3 times daily, 5 standing circles in the one direction, 5 standing circles in the opposite direction.
Yeah, and you can feel the effect throughout the whole length of the lumbar spine.
Yeah, you can see until now how it moves until there.
Great.